Senator Casey, you're next. I'm going to turn it over to you. Thank you.
Thank you, Senator Bennett. I want to thank the witnesses. I was at another hearing, so we had a conflict, so I didn't hear your testimony, but I'm grateful for your willingness to be here today and to testify about these important issues. Ms. Regg, I'll direct both my questions to you. In your testimony, you mentioned the kind of information and marketing tactics that, quote, often lead to poor enrollment decisions and undesirable outcomes, unquote. Medicare, as we all know, is a promise, and here's the basic promise: guaranteed access, no questions asked, guaranteed access to health care after a lifetime of hard work. Unfortunately, that promise is not often enough fulfilled. Despite this promise, which every member of the United States Senate and House is bound by, despite this promise, we know that many older adults and people with disabilities still have a hard time getting quality coverage because they're either confused by the enrollment process or influenced by misleading marketing, or both. Ensuring that there is both clear information and accurate information about enrollment and different health plans is the very least that government can do so that Medicare-eligible individuals are appropriately educated on how to make the most of their earned health care benefits. That's consistent with keeping the promise. I've introduced the so-called Benny's 2.0 Act, the Beneficiary Enrollment Notification and Eligibility Simplification Act, with Senator Young of Indiana. The bill would provide advance notice to individuals approaching Medicare eligibility, as well as timely information on when to sign up for Medicare. So here's my question: how important is the role of SHIP counselors like yourself in ensuring Medicare beneficiaries can make the best decisions for their needs?
We feel it's vital. We provide objective and unbiased. No one affiliated with the SHIP program can have a financial gain or a conflict of interest in dealing with the information that's going out there. We provide that, and unfortunately we see the same. Just this month we were working with a gentleman that was undergoing active cancer treatment, and he got a phone call and enrolled in a different managed care plan that none of his specialists were involved in. And we were able to get him back into his other plan and back on his plan of care.
Well, we appreciate the work that you do. And I'm also concerned about a question that has arisen, I know, in a lot of these discussions, is that SHIPs may not have the resources they need to meet the growing demand due to growing demographic trends and other challenges. Medicare funding to SHIPs and other resources for low-income outreach and enrollment efforts may be in jeopardy because it was not included in the recent continuing resolution. How can you speak to the needs for continued resources for SHIPs given the demands and challenges you're facing and the implications for low-income older adults if funding is not extended this year?
I think it's important to note that the SHIPs are very good stewards of federal funding. The return on investment with both volunteer counselors and the hours that they put in, and the dollars saved by enrolling consumers in the most cost-effective plans, signing up for the low-income subsidy or extra help with their prescription drugs, and the influx of assisting consumers with applying for Medicare savings programs far outweighs the dollars that are included in the current grant models. But the growing population, the growing scope, and the demand in every state would warrant the additional dollars.
Well, thanks very much, and thank you for your testimony. And now I'll turn it over to Senator Warren.